50% of people with lower back pain have dysfunctional breathing. How might that be? Is it the lower back pain which is causing dysfunctional breathing? Or is it suboptimal breathing patterns that are feeding into lower back pain? So breathing is 3 dimensions. And one of those dimensions is the biomechanical dimension. And this refers to whether you're breathing high, using the upper chest, or whether you're breathing low, with good recruitment of the diaphragm. So during inspiration, the brain is sending a signal via the phrenic nerve to the diaphragm breathing muscle. And the diaphragm breathing muscle is moving downwards by about 2 to 3 centimeters during rest. At the same time, the intercostal muscles are pulling out. And this reduces the pressure inside the chest, creating a vacuum there that causes air to come into the lungs. Now, during expiration, of course, the diaphragm is moving back up to its resting position. The intercostal muscles are moving inwards, and this is almost as if it's forcing the air out of the body. So during rest, the inspiration is active and the expiration is passive. And a good ratio would be that the ratio of the breath in to the breath out is 1 to 1.5. In other words, your exhalation should be 1.5 times longer than your inhalation. So if you're breathing in for 2 seconds, you should be breathing out for 3 seconds, or if you're breathing in for 3 seconds, you should be breathing out for 5 seconds, etc. Breathing high can feed into lower back pain. And the reason being is because the diaphragm is not just for respiration, but it also provides stabilization for the spine. Now, earlier on I mentioned that when we breathe in, the diaphragm is moving downwards, and as we breathe out, the diaphragm is moving back up to its resting position. And it's very important that the diaphragm is able to move freely. So up and down. It's not that the diaphragm is moving in and out, but the diaphragm is moving up and down. Now, as the diaphragm moves downwards, there's a negative pressure in the chest, but there's a positive pressure in the abdomen. And it's the generation of intra-abdominal pressure which is providing stabilization for the spine. There's a relationship between functional breathing and functional movement. If your breathing is less than optimal, your movement is less than optimal and you're more prone to injury. So if you have lower back pain, it's very important to consider how well do you breathe. Are you breathing high or are you breathing low? Don't just think of the diaphragm as respiration only. It's also there to provide stabilization for the spine.